and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today you want to talk about ultrasound therapy.
Ultrasound therapy is exactly correct. I get a lot of people saying, do I get the ultrasound today? Or I may talk about ultrasound and say, have you ever had ultrasound? And some people have had it many times in the past, others not. And then one big thing is, don't get the ultrasound therapy that we do here confused with the ultrasound for imaging. So,
sure,
like
exactly.
if you're pregnant or if you have a blood clot, they'll do ultrasound for that.
That's diagnostic ultrasound.
Right, there you go.
Ours is treatment ultrasound.
Right, therapeutic. So they're completely different. The only thing they have in common is these ultrasound waves, different frequencies, and we're not going to get into that.
By the way, the thing that you said today shocked me, Brad, is that you told me that these units are now for sale online, that people can buy.
Yeah.
So we'll have to talk about that too.
Yeah, is it worth buying an ultrasound unit online? Is it going to be effective? You can get them for less than $100.
Wow, isn't that crazy?
Right, because we spent for this one, it was about $900.
$900 to $1,500.
Right.
I know, because I bought them, so.
Okay.
By the way, if you're new to our channel, please take a second to subscribe. We got some subscribe buttons, right? Or a button over here, a red button. We provide videos on to stay healthy, fit, and pain-free, and we upload every day.
Right, and sometimes technical information like this
Right.
as well. So let's get to the ultrasound. This is a nice ultrasound. This is one that we use here, and we've got at different locations. We've bought a number of the same ones. It's a nice Chattanooga unit. We like them. So what does ultrasound do? If it doesn't do any imaging like the diagnostic,
right.
What does it do? And it does two things. There's two benefits from it. And one, it's a form of deep heat. Okay, you can put a hot pack on a muscle if you want to loosen the muscle to stretch it or to get increased circulation, but it's only going to go down 1 to 2 centimeters past the surface of the skin, and you want that heat deeper than that, and that's the big advantage of the ultrasound. So here we have the ultrasound head. Bob, you want to expose your arm for this?
So it's got a vibrating crystal in there,
right?
And it creates the ultrasound waves,
right? So it is just sound waves coming off from the head. And if I was going to do this on Bob's arm right here, this is what it's going to look like. We have to use some gel. I'll get into a demonstration in just a little bit about it. But it goes up to 5 centimeters deep. Okay. One precaution is
which is about 2 inches.
Right.
So, if you think about that, that's fairly deep.
Right. The other benefits is the mechanical benefits. And this is something that when I was in school and we were learning about this, I couldn't understand. I could understand the thermal getting warm, but the mechanical benefits, what is that referring to? And one thing that cleared it up for me is I took one of these ultrasound heads, and this was not made for it, but the one I had, you could put underwater.
Right.
And if you put this underwater, and if this was the surface of the water, and I put it below the surface of the water and could turn it upwards, you could literally see the water just rippling. And then it's like there's there's movement. That's mechanics right there. And what happens is the cells in your body are vibrating against each other, and they create friction. Just like my hands are starting to warm up now, that's how it creates the warmth, is from the mechanical motion of the tissue. But then when you got the mechanical motion, that also helps get circulation going along with the thermal effects. So you got things moving mechanically, things warming up, and it's a win-win situation for circulation.
By the way we used to test this, Brad, to see if the head was working, we'd tape around here all the way up like this, and we'd put water in there and then turn it on. And you could see the water bubbling, like you said.
Sure, it's a fun thing to do. If you have your own, I would just assume it works and don't do that, because
you could ruin the head.
Right,
I mean, these things are a little bit touchy. I mean, you don't want to. You could ruin the crystal.
Right, exactly.
If you don't treat it right.
I want to go through some precautions before we go any farther. There are some things that you do not want to use ultrasound with, and that's, for example, if you're close to a bony surface, like on someone's knee. If you're on the side of the knee, maybe an MCL or an LCL, and it's a thin person.
Medial collateral ligament.
Right.
Ligament.
It's bone right under the skin. I'm not going to use ultrasound on it. Maybe under certain circumstances for phonophoresis, which you can get into later, or I go to 3 megahertz, which I'll talk about in just a little bit.
Well, that's the thing. That shows you how deep this goes, these waves.
Right.
You can get what we call periosteal pain. It starts to heat up the outside of the bone. I mean, the outer layer of the bone. So you can even on a place where you have a lot of fatty tissue, if you put it too high,
Right.
And I've had people do this.
Right.
And in fact, in some schools, they actually have you take it up to that point so you know what it feels like.
Yeah, I got to
Did
do
you?
that. Yeah, it hurt. I did it on my finger on an underwater ultrasound unit. I put it on my finger, and they say that you'll never damage yourself because the pain will alert you.
Yeah, you won't be able to put up with it.
Right, exactly. But it is not a comfortable feeling when you ultrasound your bone to that point. Now, where were we? Kind of got off on
Are you going
that.
to talk about the demonstration, or do you want to get into that or not?
Well, yeah, let's do. Well, no, the other precautions. You don't
the
want to go over the
precautions,
bones. If someone has a history of cancer, or you're going close to an area that is cancerous, you want to stay away from that. Anytime I have someone that has cancer, even if I'm far away from the area of the cancer, I'll call the doctor up before I'll do it. And sometimes they'll say yes, it's fine, and other times not. So that's a big thing, big red flag. If they're close to a wound. Open wound, you're not going to get close to that. You don't want to irritate it.
Infected area.
Exactly.
You wouldn't want to go over the carotid arteries.
Right.
You know.
Usually you're going over where you get into some muscle.
Right.
Okay.
Is there a pacemaker on this?
No, that's TENS unit or electrical. You're not going to do this over the top of a pacemaker.
But you're right. Obviously. That's another good precaution. Is you're not going to do this over any place that has a prosthesis, like a hip replacement or a knee replacement.
Yeah, they got hardware. You want to stay away from that.
Because you can actually heat up the hardware.
Sure.
Or if you have screws or something in there, you're going to be the same way.
And so if you're going to think about buying one on your own, listen to this part because you may not be applicable.
For as much training as we had in ultrasound, I'd be a little leery to do this on my own. And the other thing that, Brad, I don't know if you're going to get into this or not, but when you're using this on your own, we always told that you really don't want to do maybe over 14 treatments of ultrasound.
Sure, right.
And so you buy a home unit. What are you going to keep doing? You're just going to do 14 treatments, or are you going to keep doing for the rest of your life? Which
I have a patient whose wife works for a chiropractor. She got a used ultrasound, and she uses it all the time at home. And it's one of those things. In that situation, I think that's wasted time.
Yeah, and I don't know if there's done studies on what the damage, or if there's damage that can be done from continual use. I don't know. But
yeah, I haven't heard of any. I don't know. I just think it's
right.
You get codependent on you think because it feels good that it's doing some good.
Right.
It's like using a hot pack, very expensive hot pack.
Yeah, exactly.
Okay, let's go to the demonstration, Bob. We'll get your arm out. Let's say Bob has some
Let me get a pillow.
tennis elbow.
Sure.
Yeah, let's get a pillow to keep you comfortable, Bob. All right, let's say Bob has tennis elbow. It's tender here. We got tight muscles here. I'm not going to do the ultrasound over the real tender area. What I want to do in this situation, I want to get over the tight muscles and get those to loosen up to take the stress off the irritated area where the tendon attaches to the bone. So you're going to use gel, and this is just inert gel, some basic gel. There's nothing in this gel as far as medication. It's simply to help conduct the ultrasound vibrations through the skin, plus it's a lubricant so that you can easily work that. You're going to turn the unit on.
And one of the precautions is that you are not supposed to, you're supposed to maintain contact the entire time you're doing the ultrasound.
It's not a precaution for the patient. It's a precaution for the device because you can ruin the head if you keep it away from the surface.
So you want to get the gel on there, and you want to make sure everything's ready to go before you turn it on.
Exactly. If you're fiddling around with this and you have it set up over here and you're going away, you might ruin your head, ultrasound head, while you're doing that.
Right.
That's one of the reasons why it takes some training to do this. And you're going to set up for how much heat you're going to have on it. Now, with our units, a professional unit, there'll be a gauge on it. It'll tell you, or a reading digital, how many watts per centimeter squared. Now, a home unit, what I could find on the ones I looked at are just rated in watts, which is a big difference from watts per centimeter squared.
Because per centimeter squared is how many, the face of
the surface area of the head. So and I usually never go over 2 watts per centimeter squared. I'm usually around 1.5.
That's where I'm at 1.
And if you buy one, they may say, oh, it goes up to 10 watts of power, which is not very much.
It may not be very much at all, depending on the size of the head.
Exactly. So, and also the megahertz, the frequency. Most professional ones have 2 options, 1 megahertz or 3 megahertz. And we usually use the 1 megahertz to get deeper. Sometimes we might use a 3, but on a home unit, the ones I've seen were at 3 megahertz. You cannot go more than 1.8 centimeters from the study I read with the 3 megahertz. With the 1 megahertz, you can go down to 5 centimeters, so you're going to get some real deep heat. So just precaution if you're looking at buying one. And then you're just going to work it here. You don't want to work it so the head goes off like this and kind of look at it talking.
Maintain contact.
Exactly.
Now, Brad, I often use this with Ketoprofen, which
Sure.
is a type of medicine that's kind of a strong anti-inflammatory.
Yep.
And this actually has Ketoprofen mixed in with the gel
Exactly.
already. And in that case, I might go right over the tender spot. then.
Exactly. But then we usually go pulsed
Yeah, we go pulsed.
at 50%.
And I imagine they probably don't even have pulse.
I
on
don't
those
think
home
they
units.
do. And when you use ketoprofen, it's no longer called ultrasound.
It's called phonophoresis.
Phonophoresis. You're freezing. How do you put it? The medication is going to go push through the skin into the affected area, and that's the phoresis part of that term.
We've had good luck with this.
Yeah,
To
right.
be honest, and I always tell patients, Brad, usually if it's going to help, it's going to help, and you're going to see some relief within 2 to 3 treatments.
Sure.
First one, not usually, but usually 2 or 3.
Right.
And we have a lot of people that get some relief from this. It's kind of a go-to for us.
Right, and it's something you'll use in coordination with some stretching.
Right.
Some
With everything else, yeah.
exercises.
Believe me, this is not the.
You don't just come in to get phonophoresis and
No,
leave.
Right. We're going over all the other things too that you're gonna do,
Exactly.
maybe massage.
Here-
or,
yeah, you can wipe your arm off. I don't care
okay.
about that.
All
So,
right.
wow.
Well, thanks for the demonstration.
Yeah,
Brad.
and this is not going to do anything for the broken heart.
Oh, yeah.
Bob. Yeah.
Brad and I can fix just about anything.
But the broken heart.
Yeah.
And this is not an option, so don't go buying one for that.
Thanks.